Hi friends, Dr. Nancy Trimbley putting the power and knowledge of your health back in your hands. Boob Massacre or Boob Massage. I'm going to tell you a little story about me, and other than the things I share about my own health journey, in Stealth Health, the book, in order to help my reader on their health journey, I usually don't talk about myself on these YouTube videos, especially when I refer to myself in the same paragraph as boobs. But I think this is super important. Just to give you a little background regarding mammograms, since my early 30s, I've had issues that I've dealt with naturally, holistically, with my hormone levels. This was quite a surprise to me when I just decided I would do a saliva test to check my hormone levels because I was beginning to understand bioidentical hormone replacement. And I found I needed it. So at that time, I used a lotion that had the bioidentical progesterone in it, and it really helped. Now, over the years, I've made the transition to BioT, and I have a BioT practitioner that helps me, and I totally recommend it. It saved my sanity. Also in my history is 2 family members that have or had breast cancer. And so because it's part of my family history, my BioT practitioner really insists that I get regular mammograms. Now, I have only had 2 in my life. And I'm going to tell you right now, unless there's a very specific reason for me to get one in the future, I am never having another one. Those are barbaric. And if you look at the causes for breast cancer, including family history, on the list is trauma and radiation. And what is a mammogram but 2 things, but trauma and radiation? So this last time, I have to tell you, this was very recently, I left the facility after that mammogram already feeling the effects of that trauma. The compression had created inflammation and pain and swelling throughout my whole rib cage, chest, and torso, all the way around to the back. It took a couple of sessions with my massage therapist doing lymphatic drainage to drain all of that inflammation out of there. That is not healthy, and it's not good for the breast material. So I made a deal with my BioT practitioner. I told her about my experience, and I said, okay, I've had 2 clear mammograms, one 3 years ago, one 3 weeks ago. Actually, it was less, it was 2 weeks ago. I said, I am going to get a breast ultrasound right now because I know my mammogram is clear, to get a baseline of what normal is for me. Now, a breast ultrasound, in complete contrast to the mammogram, it is like a breast massage. It's a little weird, I'll give you that, but it kind of feels kind of good. It takes longer, maybe like 20 minutes or so. Um, but but the great thing is that now I have a clear ultrasound. So you can't just go in and do an ultrasound blind, so to say. You have to have this clear mammogram first. So when they do the ultrasound, they have a picture of what normal is for you. They have a baseline. So now I have that, and my practitioner agreed. Okay, unless there's a specific reason, this is what we'll do periodically going forward so we can keep an eye on you like we should be. So we have that agreement. I walked into her office with a request, with knowledge, and I backed it up, and we made an agreement. So here's the thing. When I was getting this ultrasound, I had to go to a certain facility. It's not available everywhere. And the technician that was doing the breast ultrasound on me, who was very friendly, very professional, I could tell she had an accent. And I asked where she was from. She's from Russia. She's actually a medical doctor who trained in Russia. And we talked about that for a while. And I told her my experience about the mammogram. And she said, "Oh, yeah." She said, "They're horrible. Those really shouldn't be done because they create damage." And I said, "Well, why? Why in the United States are women um, um, guilted into getting those done? They're frightened into getting those done. You can't get this care or treatment unless you get this done." Unfortunately, the answer I've heard all too often is, you're going to guess, it's money. Money. And I don't know, I don't know how it all adds up. Maybe just because every woman in the United States over the age of 40 is supposed to get those every 3 years or every year. I don't know. Now, all of this is backed up by Dr. Gilbert Welsh in his book, Overdiagnosed. He has a full section of the book dedicated to mammogram and how the test may or may not be beneficial in the long run. He said, if it's needed and necessary, if there's something we're looking for, yes. But as a general screening tool, he questions it because of this, because of maybe the damage that's been done, but also because there are so many false positives, meaning the test is clear, but the way the test is read by the radiologist says, "Oh, maybe there's a problem here. Let's do a repeat mammogram. Let's do a biopsy." And often the results come out clear, as in no problem. But in the meantime, not only is there excess money, time of the patient, but the worry and anxiety that is created for the woman, for the family, her immediate family, her extended family, all to no avail. And then that worry persists in the future. He says the amount of women that are saved by mammogram might not balance out the risks that are involved. It is a fascinating read. He is a statistician, so it's a lot of numbers, but it is really telling. Now, I will tell you this too. Like many medical whistleblowers, Dr. Welsh needs our support because recently he has been slandered. His reputation has been tarnished. He was removed from a position that he held for many years. And I believe it's because he put himself out there saying, going against the grain of the conventional medical model. Meanwhile, who's at risk? We are. So I invite you to buy his book, buy both of his books. They're both really good and they're actually entertaining. And he does do an audible version, which is really, really fun to listen to. The way he tells his story and the statistics in the book, it is really entertaining. So I invite you to make your decisions based on knowledge, based on being your own best expert. And remember that the medical professionals work for you. So if you walk in, like I did, with, I have this knowledge about myself, I understand, but I have this knowledge about an alternative of what could be better, and invite your practitioner to support you in that. If they don't recognize that you're taking back your own power of your own health and that you are inviting them into that. If they don't recognize that and they reject that and reject you being your own best expert, I invite you to find another practitioner that will support you. So, as always, putting the power and knowledge of your health back in your hands. Bye for now.